Cataracts are one of the major causes of visual impairment affecting Ugandans aged 40 and above. 67-year-old Charles Setumba is one of the many who thronged Mulago Hospital this morning for free eye screening and surgery. Setumba recalls that this condition started in February last year after a friend accidentally elbowed his eye.
Akaliba ndoza alina olwala akaliba ne kayindikakuwa nintandikirawo mangu eddagala nga linsala nga limyufu nnyo lwedi.
Since then, his life has not been the same.
Nja kusaba Katonda ono ntereere kuba tobaako ky'oyinza kukola otambula otalamaga okola bw'oti.
Dr. Ann Ampaire, an ophthalmologist at Mulago Hospital, says cataracts has many forms which affect people of all ages, since it is also hereditary in some families.
So inside our eyes we have a lens, which is the one which pulls the light so that you get, just like in a camera, you have a lens. So we have a similar lens and it's supposed to be clear and colorless. So diseases exist that make that lens, instead of being clear and colorless, it becomes cloudy.
Despite the many people with this condition, the country does not have enough ophthalmologists to treat it because many doctors avoid the practice due to its poor pay.
This is common knowledge that we do not pay really. Our doctors are not the best. They are not so well paid. So we have many of them after qualifying, moving to other countries.
You take long to train as a general doctor, and by the time you're getting out, you really want to start earning and try to catch up with your friends who finished probably 3 years before you.
Many Ugandans cannot afford basic eye screening and treatment, and that is why they respond in great numbers to such free health camps. It costs a minimum of 200,000 shillings to start the process of screening, which can rise to millions of shillings depending on the treatment required. With many patients unable to meet the costs of treatment and surgery, the North Indian Cultural Association of Uganda decided to partner with Mulago Hospital to extend a helping hand.
We found that doing a cataract operation in Uganda was very expensive, and many of these people could not even afford to get a spectacle. They definitely cannot afford to even have a cataract surgery.
Without such camps in place, many poor Ugandans with cataracts would certainly go blind, since they cannot afford the treatment that most visual ailments require. However, apart from the issue of costs, there are also few eye specialists in the country, which is another hindrance to the ready availability of eye care. According to reports from the Ministry of Health, Uganda has no more than 50 eye specialists to cater for the over 36 million Ugandans, with many of these centered in urban areas. Ali Mevule, NTV.
On that pause, thank you very much.